Now, I feel for whoever is dealing with this, being in a waiting room for many hours, having pain or comorbidities like stage 4 cancer and diabetes. Sounds awful. I wouldn't wish that on anyone. But your frustration is a little misguided against the triage nurse who can only do so much. Emergency departments aren't overrun due to our laziness, but two of the big reasons are, one, when you hear there aren't any beds, that's for a couple reasons. One of them is because we have more than an entire medicine and ICU and med-surg units worth of admitted people in the emergency department who don't have beds upstairs, so they're boarded in the emergency department. That takes up beds. The second more common thing when you hear we don't have any beds is because the ratios that nurses are allowed to work in certain departments are limited. For certain level of acuity, you only want your nurse to have 1 or 2 patients at a time. Think if they're intubated on pressors, you wouldn't want them to have 7 of those patients. Meanwhile, at perhaps a lower acuity, they could have a couple more patients at a time, but there's a limit to how much they're able to safely manage at a time. Meanwhile, especially during the holidays in the emergency department, it's very often that all of a sudden you have a cardiac arrest or people that will die within an hour if they aren't attended to. So instead of voicing your frustrations to a triage nurse that's trying their best, be more concerned about perhaps the administrators that aren't hiring enough nurses, keeping enough staff around, or making sure that we're able to take care of more people safely. We're only human.